you know, on my channel, I believe in sharing the knowledge. So I also want to share with you a recent experience because I think it might be able to help others. And you know, we're all in this together. And a lot of people think of prepping as prepping for, a big apocalyptic event. But we have to prep for the things that can happen to us in our daily lives too. And those are much, much more likely to happen. So I want to share with you what recently happened to me. Hey, resilient citizens, sharing a personal story. Click on the subscribe button if you'd like to get more videos, and on that little bell icon if you want to be notified of future videos. Okay, about 10 days ago, my husband started to say he didn't feel well. And by the next day, he was feeling terrible. Pounding headache, achy all over. He would get really cold and shivering and then be too hot. But he didn't have a fever. And then he started vomiting every 2 hours. I mean, really vomiting hard. It got to the point where he was getting dehydrated and I had to take him into the ER. So they ran a COVID test, but I didn't think they did it very good. It was only up there about 2 seconds as far as I could see, but whatever. Anyway, that was their first thing. They thought for sure it was COVID. Well, the COVID test turned out negative. So they gave him some medicine for his headache, IV fluids, and some pain medication, and decided it was some kind of virus, and discharged him. Well, that was on Thursday. That Saturday, we're right back in the ER. I mean, he has gotten worse. His headache is just killing him, and nothing has gotten better. And so I finally got an ER doctor I could talk to, and I said, let's look over, his blood test. There was slightly elevated white cells, but not much. A little elevated PRC. He doesn't have a fever. He doesn't have diarrhea, which rules out a lot of things, but he does have acute nausea, body aches, and a terrible, terrible headache. So I said, it does kind of sound like COVID. And the doctor agreed. I said, would you mind doing another test? Because, I'm just suspicious. And I said, also, can you look at this bite on his arm? It was right here, and it looked like in the middle, kind of like a big mosquito bite, but then this red radiated out in a circle, and the red was getting bigger and bigger. And we both looked at it and go, I know it's not the bullseye target. It doesn't look like a tick bite, but just what if? He said, he would run a screening for Lyme disease too. So lo and behold, it came back. He had COVID. He got some more fluids in his body, some more pain medication, whatever. It took care of it for the time. Well, by Monday, he called me to come home from work. His head was ready to explode. He was just feeling like this was the end. So we went back to the ER. And at that time, we got the results. He tested positive for Lyme disease also. Now, while we were there, we were in the ER for 9 hours. They gave him 2 bags of fluid, morphine for the pain, various things for the nausea, and then started an IV of doxycycline. I can't see the full name of the antibiotic, but kind of goes by Doxy for short, right? And then ended up sending us home with oral antibiotic and Norco, and anyway, a whole bunch of other drugs. Well, 24 hours after getting that antibiotic, he was starting to feel like himself again. 48 hours afterwards, he was feeling great, just slightly nauseous sometimes. The body aches were gone. His headache was gone, which made me think that his symptoms weren't necessarily from COVID. Instead, it was from the Lyme disease. Now, luckily, we probably caught this early in the process, although wouldn't you think he'd know there was a tick attached here? But I am sure it wasn't attached for 36 hours. In fact, I questioned if it was even attached for 24 hours. And when we were in the ER, the doctor said, well, I'll test for Lyme disease, but we really haven't seen much of that here. Well, it was positive. Now, yes, we live in a wooded area, but he hadn't been in the woods, but he had been doing yard work. So somehow a tick got on him, a deer tick, and one that was also carrying Lyme disease. Now, in one way, it was good he was as sick as he was, because otherwise we might not have even suspected Lyme disease, right? Just thinking, oh, it's COVID, these things happen. And it does, because my youngest son, there's 4 of the guys that share the same house. All 4 of them have COVID, and they all had like different symptoms. One was vomiting, feeling just miserable, but no fever, no headache. My son had almost like strep throat, body aches, really bad cold. Anyway, COVID can come in very different forms. So what's the lesson in this? The lesson is you really need to have a patient advocate. This is nothing reflecting bad on the doctors, the nurses of the ER. They were all great, but they go on what you tell them and the results of their tests. If we wouldn't have mentioned he had that bite, they would have never ran the test. We would have never known he had Lyme disease. So it is really, really important to advocate for yourself or for your loved ones in a situation. In this case, I'm going, could you please test again for COVID? Because, when they did it this time, he jerked. It went up high enough, right? And it was in long enough, and it turned out positive. Now, there is the possibility that the first test was done correctly, and there just wasn't ripe yet for the COVID. But it is so important to gather all the facts and present them to your medical professionals so they can come up with the possible diagnoses. And it's a good idea to know about white counts and red, blood counts, and what is PRC? Well, it's kind of an indication of inflammation. A lot of different things your test. Ask questions as you're going through this. Does it make sense what you're being told? Question things. Don't accept everything. Not everybody is like a house was, right? This ultimate diagnoser. That just doesn't happen in the real world. So I wanted to share this. Number one, be careful that you don't have something else going on, even though you do have COVID. We had another incident where a friend, yes, they had COVID and were having symptoms from COVID, but their heart symptoms was from something totally different. So you want to be careful that a doctor just doesn't stop at one diagnosis, in this case the COVID, if there are other apropos diagnoses. Also, somebody at work took their mother-in-law in who's going through chemotherapy, and she just was like crashing, just doing terrible, couldn't even walk. So they took her to the ER and they gave her fluids and did some things, and then they were going to discharge her. And my employee said, you can't discharge her, she can't even talk straight. And they go, well, I'm sorry, Medicare, she doesn't meet their qualifications to stay in the hospital with Medicare overnight. And my friend said, then I'll tell you what, if we take her home and something happens, I will sue the heck out of you. Well, guess what? They did some further testing, and she had a urinary tract infection that went septic. So sepsis was spreading, and she was in the hospital for 3 days. But she would have went home and then probably had to be brought back by an ambulance if my employee wasn't really adamant. And sometimes you have to. And the poor, medical professionals, insurances very often call the shots, right? If you are overutilizing, you are in trouble. If you don't meet these requirements, they can't have a hospital stay. Or in this case, also for my husband, they had recommended, I always say it wrong, it's not Zofran. It starts with a Z, Zoloft maybe? It was the first drug they recommended for nausea. And when we went to fill it, they said, oh, I'm sorry, we can't, your Medicare Advantage plan doesn't pay for that. And I go, well, okay, we will pay for it ourselves, but why? And they said because they feel it's dangerous to people of a certain age. Well, that is good to know. But we went on and paid ourselves, and it wasn't that expensive. But I guess I just want you to know your body, know when you don't feel right, listen to your body. Record all the relevant details, know your history, know what's happening, and make sure you communicate well to medical professionals and ask the questions you need to ask. And as for Lyme disease, boy, you know, that can be pretty scary if it isn't caught in the beginning. His local gun club is putting it in their newsletter because it's right down the road from us, and they want to make sure people know that there is Lyme in the area and what to do to prevent a tick from staying on you, and what to do if you do have a tick that is latched on. But I have to say, in this case, I don't think this tick bite matched the, generally 36 hours or 24 hours. I think it was much less. So be concerned, period, if you get a deer tick bite, and get the test you need. That's it. I just wanted to share our experience, and I'm so happy my husband now is feeling right back to himself. Maybe just a little fatigued, but he didn't eat for quite a while. So, yeah. But I want you all to ask the questions you need to ask and get the care you need to get if you are ill. As always, this is Potpourri saying, please share the knowledge.